This is Mon Health Live, your source for the latest news, numbers, and vaccine information related to COVID-19. It's what you need to know now to make informed decisions for you and your family. Here are your hosts, Mon Health System CEO David Goldberg, Mon Health Chief Nurse Executive Dr. Crystal Atkinson, and WAJR's Kyle Wiggs.
And good Saturday morning. Welcome to the latest edition of Mon Health Live. Dr. Atkinson's taking the weekend off, but we do have David Goldberg, President, Chief Executive Officer of Mon Health Systems with us. David, good morning.
Good morning.
And we have a special guest with us, Wilma Sternthal, Executive Director of the Village and Suites at Heritage Point. And Wilma, thanks for coming on. We appreciate it.
Good morning. Thank you for having me.
Let's start with you. We're going to get some updated numbers from David in a moment, but why don't you introduce yourself and tell us about the Village and the Suites at Heritage Point.
Okay. My name is Wilma Sternthal. I have a master's in nursing. I have worked at the Village at Heritage Point for almost 20 years. The Village is a life plan community, and we offer independent living as well as assisted living. And we're conveniently located between both hospitals and many physician offices.
All right, so you're right there in the middle of it. It is a perfect location. It's a beautiful location. I've had friends that have been in there. I've spent some time in there, and it's a wonderful place just to kind of stroll around the grounds a little bit.
Yes, it is.
Very good. All right, David, we turn to you for the latest. What are the numbers? What can you tell us about the case numbers? Look like they're dropping. They continue to drop in our area and, in fact, in the entire state.
Well, let's start with the Village. Thrilled to be here with Wilma. There are no people at the Village with COVID. We have mastered, I think, with Wilma's leadership and following state rules and protocols, we have mitigated risk of spread. We've had no significant issues with the people who live there in either assisted living or independent living, and that's a testament to the residents there and the families who support those residents, and, of course, our staff and colleagues for putting these wonderful people front and center. Across Mon Health, today, we have 2 people with COVID in all 4 of our hospitals. We have 9 staff quarantined across our 4 hospitals and offices, 38 either staff or providers who are self-monitoring, and we only have 2, and let me say that again, 2 staff members with COVID across our 3,500 colleagues.
Mm-hmm. All right, so what do you contribute? What is contributing to the decline of cases?
Well, I do believe the more people that get vaccinated, the better opportunity to reduce the threat of spread, mitigate the risk of spread, and, of course, be a little bit healthier. I think that's part of it. I think people are listening to wearing their mask, socially distant, wash their hands, and being appropriate. I'm not a scientist. I'm not a doctor or a clinician, as you know, but I do believe what we're seeing is the seasonality that's coming upon us. It was about a year ago, coming up on the 16th of March, where COVID really hit West Virginia pretty hard. And if you remember, it started out slow for us and grew over time. Some will say it was limited testing. I do believe the seasonality and what West Virginia and where we sit had a lot to do with it, and I'm hoping that to be the case now. What's interesting now, as we're in this early part of March, we've also had no significant flu presentation. Why? Most people socially distanced. Most of the people who herded together didn't hurt as much throughout the year, and I think that that definitely impacts the minimal amount of spread we've seen.
Yeah, let's just take a moment. Let's talk about the flu, because all of us, I'm sure every person who's listening at one point or another in their lives have been really, really hit hard by the flu. Whether you take the flu vaccine or not, most of us do get vaccinated, we still get the flu. You're right, we haven't had that this year, and a lot of that, I think, David, is due to the change in habits. People are more aware of what's going on around them. You don't want the coronavirus, you don't want the flu, and people didn't get the flu this year.
I think that's a large part of it, and I'll let Wilma comment as the nurse on the phone to clinically correct me. I also do want to remind people, if they come to our emergency rooms and we do a biofire, we're testing for flu along with COVID, along with the PCR test and the antigen test. So we're testing people when they present. I could tell you the flu has been minimal. I'm knocking on wood that it stays that way. We've also seen respiratory issues kind of come down. We are now coming into seasonal allergy season, so we'll start people like with pollen allergies and others that might mask it. That's why it's important to stay connected to your physician.
Mm-hmm. And we're not through flu season yet. One of the worst flus I ever got was in April. I remember because it was Final Four weekend. It was late in the season that I caught it.
You're right. Most people think flu happens, Thanksgiving, Christmas, New Year's. Typically, it lingers here through March into April, maybe sometimes into early May, and then it levels off.
Okay, Wilma, your thoughts on the flu real quick, and then we'll start our discussion about the Village.
I agree 100% with David on all of. He's right on the mark. I think that just distancing and wearing your mask and not getting together and socializing like we normally do is really put the kibosh on the flu. Mm-hmm. And respiratory stuff. You don't see people a lot with respiratory things. Mm-hmm.
Okay, at the Village and the suites at Heritage Point, you were among the first people. The elderly were focused for the vaccine first. They were the very first people, the elderly in homes and people who care for them. What was that vaccination process like for the residents at the Village and the staff there?
Mm-hmm. So we're members of West Virginia Healthcare Association, and we're on at least weekly calls, if not more often than that. And I had a plan in place to be able to carry out vaccines as early as soon as I heard they were going to be coming out. And I got a phone call from them. I thought we wouldn't get the vaccines until the week of Christmas, but I got a phone call from them, and they said, "Are you ready to go? We have some vaccine we could give you this week." I said, "Absolutely." So we were able to give our first vaccines on December 16th. We planned that with Mon Health. We had a pharmacist from Mon Health come down. He prepared the vaccines, and we had our staff giving the vaccines. So we have 100% of our assisted living residents are vaccinated, and 98% of our independent living residents are vaccinated. So they're just thrilled, as you can imagine, to have those vaccines in.
Sure, and it's probably been that way for some time. You've probably had your residents and staff vaccinated since early 2021, right?
Yes, sir. We had our second vaccine on January 6th.
Okay. So how would you, how did that mitigate things? I would imagine it was just a sigh of relief for everybody once people were fully vaccinated.
Correct. We didn't even we haven't had any staff positive, knock on wood, either since that second vaccine. So we have been, very vigilant about keeping safety top of mind for all of our residents and each other.
How many residents do you have?
We carry about 150, somewhere between 140 and 150 between independent living and assisted.
Okay, and how many staff members?
58.
Okay, so you're talking over 200 people there, and again, you've made it very safe for everybody involved. You mentioned the assisted living side of it, and you mentioned the independent living side of it. Can you differentiate between those two?
Sure. For assisted living, there's just more care offered. There is 24-hour-a-day licensed nursing staff, and there's a nursing assistants also. And so they have all of the care and services that they need for all of their activities of daily living, medication administration, every need, pretty much every need is met. Chef-prepared meals, 3 meals per day in our dining room or delivered to their apartments.
Okay. And with this, through this entire thing, I know visitation was probably significantly limited, if not completely eliminated at the beginning of this thing. Take us through how that has developed, allowing residents to see their loved ones, and has that relaxed at all?
Definitely. In the beginning, we just shut down. And, we thought it was right for our independent living residents, too, who are, they're older adults as well. So in the beginning, we shut down. As the numbers waxed and waned, we made decisions about what we were going to do with visitation. Currently, we do have some restricted hours, but the they're free to come and go. We're doing that because it's important to screen everybody as they enter, and to have the right staffing and someone available to do that. We are limiting it to a few hours in the morning, afternoon, and evening. And that seems to be working just fine.
Yeah, and if I can add, I think some of the things most people don't realize is we have to follow the rules around related to restaurants. We have a beautician. We have to limit access to people who come in and get their hair cut, that it's one person at a time like any other of our hair salons in the community. Percentage of occupancy in our dining room follows what's going on in the broader community. So while it's a closed community, we still follow rightfully, and I think that's helped keep the risk low for people to spread COVID at the Village.
And I would imagine it's complicated things, Wilma, about the dining room. What is dining room capacity, 50% or somewhere in that range?
It is. We're following the same guidelines as any restaurant. We are inspected by the Mon County Health Department just as any other restaurant. So we're doing 50% capacity. It's not as pretty in there as normal because we're not using our linen, and all of the seats are 6 feet apart because you can put couples together, but you can't put two people that don't live in the same apartment together. So it's kind of spread out. So we're doing 50% capacity, and we're doing some meal delivery. And some people are just more comfortable with that right now anyway.
Sure. And I'm sorry, go ahead.
No, so that's worked out quite well. Okay. We've changed our hours a little bit, too, to flux so that we can have 2 seatings. So a lot of different things we've done.
Yeah, I'd imagine you have to expand those dining hours, no doubt, since there's fewer people that can get in. This is Mon Health Live on this Saturday morning. We'll take a break. We'll continue with the conversation. Stay with us. We're back after this on WAJR.
Tracking COVID-19 with the Mon Health experts. This is Mon Health Live. Here's Mon Health CEO David Goldberg and Chief Nurse Executive Dr. Crystal Atkinson.
Mon Health Live for this Saturday morning. Thanks for joining us. David Goldberg is with us. Dr. Atkinson is off. We do have a special guest, Wilma Sternthal, Executive Director of the Village and the Suites at Heritage Point. During that last segment, we talked a little bit about visitation policies and how they've been somewhat relaxed at the Village and the Suites because everybody there is vaccinated. That's great news. David, as we come back to you, can you update the visitation policies and the admittance policies at Mon General Hospital and the other Mon facilities?
Yeah, so first and foremost, we still screen at all of our entrances. We screen our employees, our doctors, our colleagues as they enter our clinics, our facility like the Village and the hospitals. We have adjusted our visitation hours. We now allow at the hospitals 8 a.m. to 7 p.m. We still want one consistent visitor to be able to attend with a patient. We still screen everyone for signs or symptoms. Visitors must be age 18 or older, but if there are issues with a loved one you're visiting, end of life, dementia, or other kinds of issues, you can ask to talk with one of what we call a house supervisor, and they'll review the situation and make accommodations, of course. And then on the inpatient side, we still are doing MRIs and CTs and mammography, and of course we screen everybody ahead as well. And we, of course, screen people for signs or symptoms if they're going to have a procedure. If it's an emergent, urgent situation, we take every precaution with personal protective equipment and N95 masks and make sure we minimize and mitigate the spread of what's in the air so we don't spread it or catch it. But I could tell you on Friday, we had an all-time high for a Friday here. We had over 75 surgeries and endoscopies here at Mon Health Medical Center alone. We had, I think, 5 or 7 at Preston. I think we had 7 or 9 at Stonewall, which many people are saying, is that a lot or not? We're significantly up coming out of what we've seen with COVID the last few months, and we're starting to get back to a relative new normal. But we assess inpatient capacity every day. I led off the show by saying we only had 2 people with COVID in our hospitals. That's 1 person in our ICU here at Mon Health Medical Center, 1 person at, I believe, at Stonewall that's in their ICU. Everything else is back to normal, but we're still monitoring and masking accordingly.
All right, so the protocols are still in place to keep this from spreading again having another spike. But with only 2 COVID patients, the hospital is returning closer to business as usual.
Yes, sir.
All right, very good. Wilma, let's talk more about the Village and the suites at Heritage Point and what's going on there. First of all, how about morale of the of the folks who live there and the mental health? That's been such a huge topic all winter long because it was such a brutal winter weather-wise and everything else. Now we're coming through to the spring. I would imagine people are starting to perk up a little bit, I guess, and they're able to get outside a little bit.
That's true. They're no different than we are. They have their days where they're just, depressed and over it and tired of being isolated and just want to go out and do something bad just like the rest of us do. But they do have each other. So I think they did better if they had been older and living in their homes. Maybe they wouldn't have had as much contact. But they have been able to support one another throughout this. There's been a lot more phone calls between each other and that kind of thing. But just the fact that they know that their neighbor next door is going through the same thing that they are, it has really helped them.
Mm-hmm. What about some of the activities that the seniors are involved in? And I guess that changes now that perhaps some folks can get outside a little bit.
Right. So we've done a lot to keep them engaged, even in the beginning when most of them were in their apartments. We do have an in-house television system, so we were still able to do flex with via videotape, and we did a lot of that kind of thing. And our life enrichment team would dress up in bizarre costumes and walk around and knock on their doors and give them activity packets, But now we're pretty much, they're out walking, and we started doing some more activities that they can distance. They're playing cornhole. They can kind of stay away from each other and take turns going up there and doing that. So that's worked out really well for them. They have movie nights. We have their limited capacity in our movie theater area, but they have their movie nights. And a lot of other activities that are going on. We've been able to keep them pretty well entertained during all of this.
Mm-hmm. All right, well, that's great.
And if I can add a quick thing, this week we had some town halls down at the Village. Wilma and the residents invited me to come speak. And when you ask about the morale, I mean, they're just such wonderful people. The history and the lives of the people that live there. And it has been daunting, but I led off, and Wilma and I talked about how we know how this has impacted your life. And at the end of the day, families had peace of mind knowing we were able to mitigate spread, we were able to keep people healthy. Volunteers at Mount Health Medical Center, along with others, are doing personal shopping for some of the residents so they don't have to leave. We've done activities, as you've heard, while we ramp down a little bit. People understand it, but they're frustrated. But I couldn't be more pleased with the overall tone of people. And at the end of the day, they're looking for tomorrow, which is much more sunnier than it was a year ago.
Yeah, no question. We're all looking for tomorrow, no doubt. Wilma, with your background as an RN and your background as executive director there at the Village, what advice would you have, if any, for our senior population that's not necessarily under your roof, the senior population in our area that's still living on their own?
I would say that even though the surge is coming down, and we're definitely happy to see that happening, we need to continue to follow all the CDC guidelines. Wash your hands, get your vaccine, socially distance, and wear your mask. And I believe that that's the reason why we are where we are today, and I hope everyone will continue to do that, even as it looks like it might be going away, because it's not going away.
Yeah, well, that's true. I mean, it's the vaccines have helped. All of the protocols that we've all been following through with have helped, but it's still, you can't let your guard down. I know, David, you have thoughts on that.
Yeah, I mean, our older population are more fragile. There's the ability, as we watched through the dark winter of COVID, many of our seniors ended up getting it, had some underlying conditions that caused it to manifest even more. So that's why I give kudos to Dr. Marsh and the governor and General Hoyer and the Interoper Task Force, because they focused on our seniors first. Get the nursing homes, assisted living facilities, and because we're combined at the Village with independent living, they were able to get it first, and look at where we are today. So the plan is working. Now I just see this week, now we can go to age 50 and above, which is awesome. We're starting to vaccinate more of our teachers that are, back in that age demographic. And you're starting to see it. At the vaccination center that we stood up with the health department in WVU Medicine, we're seeing thousands of people come through day to day, down in Taylor County, in Preston County, down in Lewis County where we operate in partnerships. We're seeing more and more people taking advantage of it. And with the J&J vaccine coming through, now we can, if all's right and President Biden and the administration says, we will be able to vaccinate most, if not all, adults by the end of May into June. That's a huge improvement.
Yeah, absolutely. All right, Wilma, I'm going to give out the number for the Village. I have it right here in front of me, 304-285-5575, and there's a website as well, heritagepoint.com. And if folks are interested in learning more, what's the best course? Give you a call there?
Absolutely. Give us a call. We'd love to talk to them.
Mm-hmm. All right, David, the hospital is open. The emergency rooms are open. We want to encourage, and you've said it each week on this show, how clean they are, how people are being screened. The protocols are in place. The hospital may be one of the safest places on earth to be, considering the protocols and how clean the facility is.
And it is, and I'll keep saying it time and again, vaccinate.wv.gov to register to get onto the system so we can get you vaccinated. Also, continue to be in touch with your physician. If you're not feeling well, there's televisits, phone consultations. See your primary care physician and or other your specialist to make sure you don't get sicker because you're putting it off for too long to be taken care of.
Mm-hmm. Very good. So, again, the hospital is available. Emergency services are available. And, again, that number for the Village and the Suites at Heritage Point, 304-285-5575. Guys, great information. Wilma, it was nice to visit with you this morning, and thanks for your time.
Thank you very much.
And David, great job as usual, and we'll talk to you again next week.
Thank you, and let's go Mountaineers.
All right, David Goldberg, President, Chief Executive Officer of the Mon Health System. You've been listening to Mon Health Live, 104.5 FM, 1440 AM, WAJR.